Good morning, everyone, and thank you for joining us today. We'll go ahead and get started because it looks like we've reached sort of critical mass on those that will be able to join us live. And so I'd like to extend a warm welcome to all those that are able to join us live or those that are viewing the recording. My name is Dr. Michael McNeil. I'm the Associate Vice President for Administration and Chief of Staff at part of the leadership team in Columbia Health. And it's my honor to share some information with you today about our piece of the university as students and families prepare to join our community. So first and foremost, I do want to extend a warm welcome. We are very, very excited to have our newest batch of students joining the university here shortly and want to share a little bit with you today about health and well-being, both about the services we can offer to support students, as well as a couple of task items that are health associated when a new member of the community joins us. I do want to invite questions throughout today's session. We invite you to use the Q&A feature. The button is usually the bottom center of most Zoom screens. Feel free to submit those questions at any time during the session. And my colleague Gail and I will be watching for those questions, and we've allocated some time towards the end of the material today to ensure that we do our very, very best to answer your questions today. We will also be sharing some resources with you throughout the session that'll pop up in the chat. So let's begin with a little bit of a frame. And why do campuses offer health and well-being resources? Why do we have Columbia Health? And we like to sort of center that thinking on a quote from so very many years ago, but it really speaks to, in our minds, why we do what we do. And the sort of TLDR of this is that if a person is not healthy and well, it really inhibits their ability to perform in any other area, whether it be academic or co-curricular. We all do our very best when we are well. And so Columbia Health centers our work and really focuses on helping students stay well or return to a state of homeostasis or well-being if they are unwell, so that they can really get back to the focus of what brought them to our community. We know that students have a number of personal and academic goals that they wish to achieve during their time at the university, and we really want to be a part of helping them get there. We always describe success in our organization as the moment of graduation, right? We're super excited to welcome you this fall, but we're also really looking forward to that point in the future when students graduate, and that we can be there with the students, with the friends and family, to really celebrate and lift up that accomplishment, and knowing that health is an underpinning to getting to that moment. So I'll share really briefly with you our mission and vision, just so you understand that we have a bit of a base on which we do this work, right? We work to advance the well-being of the university community and that personal and academic development of students. That's the piece I was just mentioning. And we sort of have this aspirational vision of doing this in an integrated, accessible, quality way that produces the best possible and most enduring outcomes. We're not an organization that will settle for status quo. We are constantly striving to improve. We are and I'll jump to the next slide here. We are a fully accredited health organization. We're accredited by AAAHC, the Accreditation Association for Ambulatory Healthcare. We've been accredited for so very many years. And we have our next accreditation site visit is actually coming up this December. We choose to pursue this voluntary accreditation, and less than 10% of college health programs are accredited. And we do this as an external marker to validate that we are doing the right work that keeps our students centered in our organization. Right? We offer more than 70 different programs, resources, and services. When I do new student orientation sessions, I often will say to a student, we offer things you didn't even know you needed yet. Right. And that's exactly why we hire the very best and experts in the field of college health, is so that we can anticipate needs and we can focus very much on prevention, right, to help keep people healthy, and staying in the classroom, continuing with their projects, engaging in those co-curricular opportunities, et cetera. We do recognize our students are global, so our programs, resources, and services are available more than just on the Morningside campus. We have those in-person and virtual supports, and we're very proud of the fact that we can arrange and facilitate services directly or indirectly, regardless of where in the world one of our students may be located. This is very important to us because not only do students come from across the globe to study at Columbia, part of their studies may include them going back out to yet other parts of the world, and we want to make sure that their health and well-being is supported throughout that process. We do have 3 units that offer a 24/7 access to a support resource, and I'll talk very specifically about this coming up. And I do want to reinforce that Columbia Health as an organization is completely confidential, right? Students can share with us information knowing that it doesn't link back to their academic record, that we are very focused on protecting their privacy, so that we can really, they don't have to hesitate in what they share with us. And I do want to say thank you. I see questions are already starting to come in. We'll definitely get to those. So thank you for sending those in. Feel free to continue to drop questions in that Q&A feature. So in terms of how we work with the community, I'm sharing, I often refer to this as my humble brag slide. We just reflects sort of the volume of work that we do. 50,000 plus medical visits, over 6,000 unique students seen in our counseling center, over 15,000 participants in our prevention trainings and workshops, over 30,000 accommodations. And for most people, students included, they look at this and they're like, well, why are you telling me this? And the take-home message of this particular slide is the idea that to engage with Columbia Health is actually a very common part of a student's experience. Some students will engage with us weekly because they have allergy shots and we've taken over providing that care. And so we see them every week for that process. And other students may only engage with us once, and that's okay, right? It's about having that resource that's available to meet students where they are as it's needed to help kind of keep them focused on their goals, right? But to engage with us is actually quite common. And for our family and friends that are in the audience, either the live audience or viewing the recording, you can be key advocates. And I'm going to talk a little bit more about that later in terms of helping encourage students to connect. We know for some students, this will be their first time managing their health and well-being on their own. And so we want them to know, A, to engage with the support resource is actually quite normal. It's quite the common experience, but also B, sort of how to connect, right? And there's a lot of information here. I always say to new students in orientation, if there's only one thing you can remember out of a Columbia Health orientation session, it's remember that we exist, right? That we're here to help. The rest of it can be figured out in the moment. Just remembering we're here as a resource is sort of that critical first step. So let's talk about what care looks like, right? And we always say that students' care begins with our team. We sometimes will use the phrase on or from campus because we know they may not be on campus, but the support will emanate from our group. So a little bit about what that looks like, and I'll give you a couple of examples from each of our different departments. So on-campus care is both in-person care and virtual care. We offer telehealth. We've offered telehealth for a very, very long time because we want to make sure that students that don't need to come sit in our waiting room can still access care without needing to visit for example, the waiting room of the medical service or the counseling service, et cetera. We are ambulatory care, right? So we don't have an overnight infirmary, but we do have overnight access. And I'll talk about that as we continue through this morning. So those routine as well as urgent care, right? We know that sometimes students wake up and they just don't feel right. So we have that urgent care piece built into our service so they don't need to go off campus, right? We do have the counseling center, which is centered around a short-term model, but please note there are no visit limits in our counseling center. It's about making sure students have access to the right levels of care. Sometimes that's on campus, sometimes that's best provided through a community resource, right? It's about the specific needs of the individual. Disability Services provides both short-term and ongoing accommodations for members of our community. We have very comprehensive national award-winning health promotion programs. And then we also have our sexual violence response team, which has 2 arms, a prevention arm and an education arm. I'll tell you more about that just coming up here. See if I can get my slides to go. There we go. So medical services, most of our students are going to schedule at what we call a same-day appointment. That means within 24 hours. So we have a rotating automated opening of appointments that happen. So every hour, appointments for 24 hours forward open up, right? Most of this is because students want to be seen fairly quickly, right? They sort of, that example from earlier, they wake up, they don't feel well, they want to be seen quickly. So the bulk of our appointments are reserved for that type of process. Now, for students who have ongoing health needs, chronic conditions, et cetera, they can pre-schedule advanced appointments. That is not a problem at all, and we have a process in place for doing that. Students who might need that level of care, we ask them to make sure they indicate that on their health history form as they fill that out when they're onboarding to our community. And I'll mention the health history form again coming up. Students will sometimes log in and find that most of the appointments or the appointments that don't conflict with their academics are already taken. And what we say is, if that's the case, when you look in the patient portal, please give us a call, right? Because we're always holding back a few appointments so that those that really need to be seen today can be seen today, right? That's how most major medical practices work. And we want to make sure that we're able to meet that need without double or triple booking a provider. So what we need students to do is if they log in the portal, they don't see an appointment that fits with their calendar, is give us a call, right? They'll speak with a member of our care team. And if they need to be seen in person, we'll get that sorted for them. On the counseling side, students begin their process of engaging with our counseling center with what we call a treatment planning session. This is a shorter, roughly 20-minute session that helps us understand sort of what's leading them to reach out and how we can begin to get them connected with the care process. Those can all be scheduled also through the patient portal. Students log in, they choose a day and time. Those can be done in person or telehealth. We offer both for those. Most students actually choose telehealth for this particular type of thing. And then they would be connected with the members of our team to better understand their needs and develop a care plan. Students can request a particular provider. We encourage them to read the bios on the medical and the mental health side. Take a look at the descriptions of our providers on our website. If there's someone in particular that you believe you may connect better with, you can always request to see that person. And students can change their primary care provider in medical or a provider in counseling center at any time themselves through the portal or by speaking with a member of our team. I mentioned just a moment ago our disability services team. They provide a wide range of support, whether that's classroom needs or housing needs or testing accommodations and so much more for students. Any incoming student that had an IEP or had other supports as they completed their previous education programs, we encourage them to go ahead and connect with our disability services team. You begin the registration process through our website. It doesn't commit anyone to any particular accommodation. It just helps us know who you are and get to know what sort of support you might need to have an equal opportunity at Columbia. Right. So we always encourage students to register early, and then you can work with the team to determine what accommodations, if any, would be appropriate. It's always much harder to do if students wait, because then there's sort of an urgency to it that could have been avoided and really helps position students for success. This includes ongoing care needs. Learning disabilities is an example of that, or something very unexpected, a twisted ankle, and you need access to certain elevators. Our disability services team can help facilitate that. Our health promotion team, known as Alice Health Promotion, offers both individual and group resources to help support, develop, and build skills where healthy choices are both the easy choice, the default choice, and the norm in our community. This might work one-on-one through a program like our wellness coaching program. It might be using things like our web resources like Go Ask Alice. If you're not familiar, Go Ask Alice is the oldest health Q&A website specifically for college students in the world. It started in 1993, so it's older than most of our students, and it's continuously updated. It's a safe, anonymous place where students can look at the archive of thousands of questions that past members of our community have asked and the science-driven resources that back up the answers. Our sexual violence response program I mentioned earlier, we have a certified rape crisis center on our campus. We always hope that we never need that, but we do have that resource available should it be the case. Our team works on the sort of public health level to help encourage and build a world free from all forms of violence. And then for those that might be a survivor or co-survivor, we have individual advocates and resources available to provide support. We do have individuals that join our community who have already had a past experience for which they did not receive care. And one of the markers of success for us is when those individuals come forward in our community requesting help for something that occurred before their time at Columbia, because they finally feel safe. right? They feel like they're in a place where they can trust the resources that will help them, and we're very, very proud of that. So SVR is available 24/7 by phone, and we will do in-person accompaniment if there were a need 24/7. We will dispatch our staff throughout campus, throughout the city, as needed 24/7 with our advocate teams. So in SVR, and then reflected on this next slide, our medical services and our counseling services all have somebody available by phone 24/7. It's very important to us that people be able to make that phone call and access care and access a member of our team. Okay, so that's all the on-campus. Let me talk very briefly about the off-campus pieces. And I am going a little bit fast here, but that's because I really want to make sure we save plenty of time to answer your questions. And I do see they continue to come in, and I thank you for that. So off campus, we do have a limitation on our space on campus. So there are a few things that we need to refer off campus for. And we have built a network in both in the Morningside Heights community and throughout the city to make sure that students can access that off-campus care that does two things. It prioritizes their health and well-being, and it minimizes their out-of-pocket costs, regardless of their insurance coverage. So those are the sort of key two mindsets. We want to make sure that we're referring people to care providers that meet the standards we know our students deserve. So for most people, we will see them first, and then we would provide that off-campus referral. This is essential if a student is on the Columbia insurance plan. I'll talk more about the insurance plan coming up, and I know there are some questions related to insurance, whether it's enrollment or waivers, so I'll definitely get into a little bit more about that. But if a person is on our Columbia Student Health Insurance Plan, they are required to have a referral from our team in order to go off campus. So examples of why we might send someone off campus include prescriptions. We don't have a pharmacy on site, but there are 6 within close walking distance. If it is after hours and somebody needs to go to an emergency room, it's truly that serious. They've called our team has triaged and recommended they go to an emergency room, right? That would be off campus. For our students living on or very close to campus, the closest emergency room is actually directly across the street from campus. So there's quick, close access, and we do have staff members credentialed at that location, at that hospital, so that if a student were to be hospitalized, that we would go and we would visit them on a daily basis and help not only make sure that they're doing okay in this unfortunate moment of hospitalization, but also so that we can help manage their care as they're discharged and returned to campus. We have a number of specialty related pieces we can do on site, but there are some for which we need to refer off site. Again, this is where we have that broad network of folks that we've vetted to make sure that we're sending students to providers who have the expertise and will deliver the quality of care that we know that our students deserve. The same is true for radiology. That's x-rays and the like. We have 77 locations throughout the 5 boroughs that students can go to access radiology. And then students who are seeking long-term mental health care, most students would see a provider in the community. And again, same thing, we have vetted all of these providers. We know them quite well. We know their staff, if there is staff in that office beyond the provider, so that we can help smooth things along the way and make it a positive off-campus engagement piece. Okay, so and one thing I did forget to mention back when I was talking about the on-campus care piece, all of the things provided on campus are what I refer to as insurance agnostic, meaning it doesn't matter if the student has our university insurance or they are on a parent or family plan. Everything we do on campus is covered by the health and related services fee. That's a mandatory fee that is required for all students as a part of the university, and it covers everything. So when a student comes to the medical service, or they go to the counseling center, or they engage with any of our other resources, programs, or services, they're not paying anything out of pocket, right? It's all covered. It's when we send a student off campus where insurance begins to be a part of it, right? And so we want to make that really, really clear that insurance doesn't affect the services that are available on campus. Okay, so I mentioned at the very top, I wanted to share a little bit about the requirements for new students. So this is our quick short list for incoming new students. The first piece is submitting their immunization requirements. This is university policy and to ensure compliance with New York state law. So there's a MMR requirement that's either 2 doses of the measles, 1 dose of mumps, 1 of rubella, or if for some reason someone does not have access to their original records, they can do a blood test to prove immunity on MMR. And then New York State requires what we call an informed decision on meningitis. While we strongly recommend this vaccine, the New York State requirement, and therefore our university requirement, is to read the information that we provide and then indicate a decision. Please note that for students who indicate they have had the meningitis vaccine in the last 10 years, when they complete their form, they are then required to provide proof that they have had that meningitis. It's the ACWY meningitis vaccine. Their meningitis decision process would not be complete if they do not upload proof of that. There are 3 choices on the meningitis decision process. The student can indicate they've had the vaccine, they intend to have the vaccine, or they have read the information and they decline to have the vaccine. Again, we encourage it, but it is technically not required, whereas MMR is a requirement. Students need to do that at least 30 days before they are scheduled to register or upon admission if they're waitlisted or their acceptance occurs less than 30 days before registration. For many of our incoming undergraduate students in particular, they've already submitted these, and I'll talk more about that process in just a moment. The health history form that I alluded to earlier should be done before the first day of classes this year. That's September the 3rd. Same with updating a local mailing address. The local mailing address is critical if the student is going to be on our insurance plan, because we want to make sure those materials reach them. And then the time frame to complete the decision process on the insurance, which is either enrolling or waiving, is September the 30th. And I'll talk more about that coming up. So and that is open now and it runs through September 30th. We have a very long open enrollment period. Okay, so a little bit more detail on the immunization piece. So it's those same 2 requirements. And then we do want to let you know that while we do not have a requirement for flu vaccines, the majority of the members of our community will receive a no-cost flu vaccine from our team. We start offering those late September to early October. It's typically early October. We offer mass vaccination events where people can just walk in, get their flu shot, and be on their way. Typical throughput time is under 5 minutes for most people. And then if for some reason the dates and times of those large events don't align with the student's academic calendar, we can also provide the flu vaccine in our medical service location or in conjunction with a medical services visit. In terms of meeting that immunization requirement, the student will complete this process by uploading material to the patient portal. This is not something a parent or family member can do for them. The student will need to do this for themselves. We strongly encourage, we ask that you please have your provider complete the Columbia form. That's the easiest and quickest way to achieve compliance. We know that's not always easy on your end, on the student's end, or on a family's end. So if that's the case, we will accept other documentation, other records, but those records need to have the name and date of birth. We ask students to add their uni actually to any of those uploads. And if a document is not in English, it must be accompanied by a certified translation. Self-translations are not acceptable to meet the requirements. This is why we encourage people to use our form, because it's a lot easier. It's in English. It sort of takes care of all these other particular items. We are looking for the yes here. That is our philosophical approach when we are reviewing immunization compliance documents. And if someone does have a medical or faith-based condition or situation that would require consideration of an exemption, we do have a process for that, and that is fully described on our website. So once a student has submitted those documents, please allow up to 10 business days for our team to review and verify. Again, we are looking for the yes. We're looking across the documentation submitted to find that the requirements of the university have been met. If for any reason the uploads do not meet the university requirements, the student will receive a message to their university email that indicates what is missing and how to achieve that compliance. It's very important for us that we provide very direct guidance to folks, because again, we're looking to get to the yes. We understand that every student has a registration hold until they meet the immunization requirements. We will not and cannot lift the hold temporarily for a registration because a student is in process or trying to get their documents, et cetera. So that's why we ask people to do this as early as possible, because we understand that there is that registration limitation. And we want to get that taken care of and out of the way. Okay, let me move on to a little bit more about our insurance, because I know there are several questions around the insurance. So Columbia does have an insurance requirement, and this is an annual process. Our goal here is to ensure that our students have quality, comprehensive coverage in New York, because that's where they're studying. And it can be obviously through the university offered plan, but we're absolutely fine with approving a waiver if the student has the same level of coverage, that same coverage that meets the university requirements through, for example, a family plan or parent plan. Not a problem, right? It's the goal here is look for the yes and that comprehensive coverage, right? Students may have already started receiving emails. This is about the time of year where we start sending emails about needing to either enroll or waive. Students will continue to receive those emails until they take action, right? There's typically about 13 emails that are done from the launch of open enrollment to the deadline date. And the reason we keep reaching out to students is any one message they may see and say, oh, right, I need to do that. And then they kind of forget. Right. So we want to keep reminding them that this is a requirement. They need to take action here. Anyone who does not take action by the September 30th deadline is automatically enrolled in our plan and is responsible for the costs of that plan. Those that are considering a waiver, and I'll talk more about waivers in a moment. We want to make sure that you submit that early again, so that we can, if any additional information is needed, that there's plenty of time to take care of that. Right. This is also something the student does through our patient portal. So if needed, you might want to sit with your student and sort of, especially if this is new to them, and sort of walk them through, where is their insurance card and what is a member number and what does that look like? A copy of the card or a photo of the card will need to be uploaded with that waiver request. I often think of families as the first teacher, right? Each of us, the beginning of our educational process was with our families. And so this is an opportunity for parents, especially of undergraduates, tend to sort of want to do this for their student, just take care of it. And we absolutely understand that instinct, but they're about to come and join our community, and they're gonna be doing some of these things on their own for the first time. So this is a moment to sort of lean into that first teacher role and sort of sit with them and do this. We do have step-by-step instructions, and we have a video to help, right? We've done what we think are a variety of things based on feedback from students to help make this as easy a process as possible. So let me tell you more about that insurance, right? For those that are going to be on the university plan, it is a platinum level plan with national and global coverage. Premiums are automatically assessed to a student account, even among those who will be requesting a waiver. Not to worry, if that waiver is approved, those charges would then come off for the insurance, not for the health fee, but for the insurance. And we encourage you to take a look at the plan tools. We have a compare your coverage tool. And if you were to want to compare the price and the coverage of our plan to, say, an exchange plan, you want to compare to a platinum plan on the exchange. We do this comparison annually across the state of New York to see sort of if you wanted to buy through the exchange coverage equivalent to the university plan. And it's generally 3 to 4 times the cost of the university plan if you were to go through the exchange to obtain equal levels of coverage. Our undergraduate community is the largest community that requests and are approved for waivers. So we recognize this, and we certainly have a pretty thorough process to make sure that we can support this, right? In order for a waiver request to be approved, we need evidence that the coverage meets the university requirements in full, right? So if any one of those university requirements were not to be met, we cannot approve the waiver, right? When we review waiver documents, we are looking for the yes, same as we are with immunization. So if we stumble across something that is an obvious no, that's the point at which we stop our review, right? Because we've run into a no that we can't get past, and we would then immediately communicate with the student about that, right? So please note that we aren't going to keep reading if we run into a hard no, because we want to get that quick response back to the student, because there's already something that has has blocked our ability to approve this waiver request. The majority of waiver requests are approved, but we do know there are some plans that don't meet university requirements, and this is especially true of our international students. There are unfortunately some companies out there that will tell our incoming students that they meet our requirements. They don't. We have no control over what they say, and so we always say, if you were thinking about buying coverage, please talk with our team first, because we can't help if they won't give you your money back and it doesn't meet the requirements. So we always say, let our team help. Our employees and our insurance team, they work for the university, not for an insurance company, right? So that they can keep students as their priority, and that's very important to Columbia that we do that. As I said before, all of these enrollment decisions or waiver requests are submitted by the student in their patient portal. Okay? If you want to spend some more time learning about our insurance and the waiver process, we have scheduled a webinar to try and sort of facilitate that process for you all. So there's a QR code you can scan, and I'll leave this up on the screen for just a moment, so that folks can take a look at that. And we invite you to join us for that webinar, and it's especially designed for our undergraduate students and their families. We offer a series of these, but there is one sort of for you, and so we wanted to make sure we invite you to that. Okay, so one of the questions I mentioned that first teacher piece. A student may be more likely to call a family member than us when they don't feel well. So we want to tell you where we are, and how to reach us, so that if they call you instead of us, you can then point them back to us, right? So that we can help them. So we operate from 3 different buildings. I know this is very, very small on the screen, not to worry, all this information is on our website. Lerner Hall, which is sort of the student centers, where our counseling center and our sexual violence response program is. John Jay Hall, which is has the largest of the dining halls in it, and also has first-year residences above the space that we occupy. It's home to our health promotion team, our medical service, the insurance and immunization offices. And then Ween Hall, which is also an undergraduate residence hall on the ground floor, is where our disability services team is located. Obviously, our website, every unit at Columbia will encourage you to visit our website, and we all mean it, because there's so much information there. And again, optimized around the feedback from students. And we do have one phone number that will link you to any part of Columbia Health, and that's the phone number that we've put on the screen here. 212-854-2284. It is a phone tree, and I know that can be frustrating for some folks, but you don't have to know the specific numbers to each of our units. That one number will allow you to connect with all of our departments. For our website, there are a couple of things we do like to highlight, and this is focused mostly on the student, but for family members to know this is there, right? So it helps them sort of direct their student. The access to the patient portal to schedule an appointment is right up front and center. We do have what's known as a real-time hours module. So if home is not the same time zone as New York City, and you're trying to figure out, wait a minute, would their offices be open right now? You don't need to do time zone math. You just need to visit our website, because it will tell you if we're open or not. During the week, our medical service, for example, operates 6 days a week, Monday through Saturday. But then again, after hours, we've got that phone call access. So there's always that 24/7 opportunity to connect. That patient portal I've mentioned a couple of times, students logging in to do their immunizations insurance, that's there. And we do have a page on emergency resources. If a student is experiencing an emergency, we're hoping that they're calling for help, but sometimes they visit our website, and so we want to make sure that that's easy to find for our students and for our family members. For those of you that like to engage with social media, there are a few different ways to connect with us. Following us on Instagram or Facebook is a great way to know sort of what's happening in the world of health on campus. Or let me give you an example from earlier. If it's flu shot season, right, it's time. You'll see our posting about that on Facebook and Instagram. So you might remind your student, if you're a family or friend, hey, the next Tuesday they're doing flu shots, type of thing. I saw it on Instagram, or you can share things with them, et cetera. It's just an example of ways that we share information with our community, and you can stay connected. So I've shared a lot of information over the last 35 minutes. And so what I'd like to do now is really focus on some of these questions. And there's a bunch of questions. So I'm going to do them in the order they came in. We may be jumping around on topics a little bit, but I want to sort of do my best to get to all these questions. And I am absolutely in awe of the number of questions you have submitted. So thank you so much for that. This will not be your only opportunity to ask questions, but I really, really appreciate you sending those in today. So the first question was around insurance waiver, sort of what's covered by the fees and what have you. I'm sort of paraphrasing. That's that health fee versus the insurance piece, right? Where the health fee covers everything on campus, insurance only applies with off campus, right? Being granted a waiver on the enrollment from the Columbia plan means you'll have coverage that works off campus if we need to send you there, but the health fees covering everything we're doing on campus, right? Next question we got was about some of our specialty teams, specifically asking about our eating disorders team. So we have a number of specialty teams on campus to support students. Our eating disorders team is multidisciplinary at the university, and those services and resources are for the on-campus pieces are covered by the health fee. The off-campus pieces are definitely covered by the student health insurance, maybe covered by other insurance as well. That would be a great moment if you want to make sure you have the right level of coverage around that item, where you meet with a member of our insurance team during their drop-in hours to sort of learn about or review your existing coverage and whether the Columbia plan or existing coverage would provide the better resources there. Our team is actually very accustomed to doing that. So another question about the waiver piece in the on-campus, same, right? On-campus is all health and related services fee, so having a waiver isn't going to restrict your access to on-campus care. We've set it up that way actually intentionally so that everybody has the same access. And one of the things I didn't mention around insurance, but this is a good point to insert this here, we do have a voluntary dental plan and a voluntary vision plan. These are available to students regardless of their medical and mental health coverage, right? So those with a waiver can still enroll in those dental and vision plans, just like those that have the Columbia insurance. We've separated those processes because we know some folks may have very excellent medical coverage that will address their needs while they're studying in New York, but they don't have any dental coverage. Well, they should have an option too, right? So that voluntary dental and vision is available to all students, regardless of their medical coverage. Next question, also about insurance. The card will be available to download about 14 business days after registration, but arrive earlier than that. If I can speak, let me speak very specifically to the Columbia plan. We're working with our insurance provider. Our current insurance provider is Aetna Student Health, to try and get that time frame down to 3 business days. Coverage is retroactive to August 15th. If somebody activates their coverage after that date, it will retro to August 15th. And if you aren't registering until you arrive in the US, not to worry that you'll have coverage for that period, even if it's sort of activated in the system a little bit later. There's a question around conditions and the medical history, that health history form, can it be amended? Students can't change their health history form once they submitted it, but by engaging with our care team, we can update that information so we have it on file and that all care providers would know that information and be able to ensure the right level of care and support. So think of it as iterative on our side, working from the base provided to a student when they first onboard to the community. Another question, I think this is insurance related, around global coverage for an international is accepted in New York. So if I'm not quite sure the origin of the individual asking the question. So if this question is from someone outside the US and you are not sure if your international coverage will meet university requirements, that's where I invite you to engage with our team, right? That dedicated health insurance team, where they can take a look at the existing coverage and let you know if it meets university requirements, right? And more importantly, if it doesn't, you would know that sort of upfront. We will do those reviews. We also have checklists and guidance tools on our website so that you can do some of that yourself. But if you're still not sure, please engage with our team, right? We don't want to say no to a waiver request. So therefore, we say, engage with us before you formally submit, because that'll help us figure out if there. And there are a few international plans where the provider will tell you they meet our criteria, but we can tell you that they don't. It's very unfortunate that there are some nefarious actors in this space that are very eager to take the money of our families and students, but don't actually provide the quality level of coverage that they claim they do. And that's why we want you to talk with our team first. Another question around health history form. This is specifically about records in another location or a previous institution. You can request the previous institution send a copy of records to us. Absolutely. You would do that through that other organization or school, and ask them to forward those records to us. We're happy to have the health history form be addressed that way. Question about, is a TB test required? It is not required. We will, as we review health history forms, if individuals are coming from areas of TB concern, we may encourage them to come see us for some follow-up, but there is not a TB requirement at Columbia. A question around financial aid covering the medical insurance. So depending on a student's financial aid, this gets a little complicated because it's very student by student. But there are a number of financial aid resources that do cover the premiums for the Columbia Medical Insurance. Some of the scholarship programs do it. Some of the within university programs do it. So it covers the premium. And in some cases, it also covers the health and related services fee. Remember, you'll see those two different fees on there: the on-campus health and related services, this and the medical insurance is how it's labeled on the bill. What I would encourage you to do if you're not sure if your financial aid package covers that is to connect with the financial aid team. Unfortunately, we can't see all of those records on our side, and honestly, that's a good thing, right? We're protecting privacy there. But start by checking with the financial aid office, and then we can work with them and the student if there are more specific questions we need to take a look at. There are a number of scholarship programs out there that do cover the health fees and the insurance. You just have to remember to ask for that as a part of your scholarship, right? So make sure you're indicating that for those that may be receiving scholarships. Another question, is it mandatory to have a local address? Absolutely. Every student will have a local mailing address through the campus mail center, so you can always use that. But it is mandatory to have a local address, especially if you're on the student health insurance. Another question about on-campus care. If a student makes an appointment on campus, are there additional fees to be paid? The general answer is no. We don't do billing like that. We don't want to. There are a handful of travel vaccines that are not covered by the health fee. These are not common vaccines that folks might need, sometimes needed for study abroad or what have you. And we do have a cost recovery system. Columbia Health operates on a nonprofit model. So the students, for those vaccines that are not covered by the health fee, it would just be the amount of the vaccine, and it's, students pay what we pay. That this isn't about making money, this is about providing care. But generally speaking, a student will pay nothing when they access our services across the university resources that we offer. So a person has said they heard you can lift the registration hold if for one dose of the MMR uploaded contingent on the second dose within 30 days. Is that true? So the answer is a definite maybe, right? You do need to wait 28 days between the first and second dose of MMR. So if somebody is just beginning that process and they get that first dose, we will do a temporary release, but only if that first dose was recent, right? So if that first dose was at age 2, we're not going to do it now, right? It's only when somebody is doing that first dose now that temporary release. So it's uncommon, but it is possible because there is that medical 28-day window period. There's a question on requesting an increase in financial aid to cover the cost of insurance, that is something you'll need to talk with the student financial services and the financial aid team about. Again, we don't have access to any of those records, but start the conversation with that team. And then if you need us to be a part of the conversation, let us know. We're happy to help. We want to make sure that we're providing whatever may be needed in that particular case. Where to provide the local mailing address came up. So there's a system called SSOL, Student Services Online. ssol.columbia.edu is the web address. That's where you would indicate your local mailing address. And that's populates it to all the other university systems that use a local address. So you can update it in one place, but it propagates to all systems, including ours. You can do it directly in our patient portal, but if you have a different address in the central university system, it will overwrite. So we always say do it in SSOL, and then you don't have to do it again. Another question indicating the student is at a summer program without internet. Congratulations, that's a wonderful thing these days. Is there a way to see what's on the health history form that the student needs to complete? We don't have a printed copy, but it is what you would expect as a standard health history form. If you've ever filled out health history form at any medical provider's office, ours is very, very similar. It's just electronic. And for most people, they can do it fairly quickly. And again, the students need to do that before the first day of classes. So if your student is away currently and doesn't have access to the internet, not to worry, there's still time to get that health history form done. A question around vaccine records. Can you send in what they have while they wait for the medical provider to complete the Columbia form? Of course, right? You can go ahead and upload what you have while you wait for the provider to complete the form. Our team will review it. If it gets you to compliance, you'll get an email that says, congratulations, you're compliant. If for some reason it doesn't get you to compliance, you'll get that email that indicates what else needs to be done. So yes, you can submit what you have, just remembering to note, if it is not in English, you do need to accompany it with a certified translation. Okay. The next question was, if a student wants parental input on their care, what documents do we need in order to talk with parents? So what I'm going to share, it may not sit as the favorite answer with everyone. What I'm going to encourage is to lean into that teacher role. Right? Let the student share with you what they choose to share around receiving medical care, right? Rather than having a parent or a family member talk directly to our team, it's talk with the student, right? Help prepare them with questions they may want to ask our team, or how to request additional information from a medical provider, right? For those of us that haven't had a chance to do this as an adult, we sort of come to know how to do it. But none of us knew how to do that originally. We all sort of had to learn. I think it's best when we can learn from those we trust, like our families, and let students really be empowered to be the center of the decision making around their care. I know it's new. We absolutely know how much you care and want to make sure students are getting quality of care. But we want to center it in the student learning to be a self-advocate, and we want to be your partner in helping the student learn that. If it becomes necessary for us to speak directly with a parent, we do have a consent form that a student can complete that would give us permission to speak with a parent. That's not terribly common these days, but it is available should it be needed. There's a question around MMR, and if it's 30 days before registration, aren't we already past the deadline? It may be, right? We share the same deadlines for every program. So we say it one way, no matter who we're talking to. And that's why we always say, do it as early as possible. And in the undergraduate community, we've been seeing hundreds of records a day, and it's been wonderful because we've been able to clear those holds well in advance of registration. To be completely honest with you, we aren't given a copy of the registration schedule for each of the academic programs. So we focus on sort of what do we need, and because there are so many different registration options across the university, and they're all very localized to academic programs, if everybody gets it to us at least 30 days ahead of time, we're going to all be good. And just to help you understand, the 30 days isn't arbitrary. The reason we use the 30 days is because of that 28-day window between MMR dose 1 and 2. So if we have everything at least 30 days out, if a person were to need to do 2 doses of MMR, they can do both before that hold would actually block their registration, right? So we've applied a particular medical science piece to why we've established the 30-day time frame. So there's a question around, is there a health insurance appeal for those who may not have insurance, but not in a financial position to pay for the required insurance? If I'm being completely blunt, the short answer here is no. The cost of the plan is not a criteria to request a waiver, right? This is about comprehensive coverage. And I'll be very transparent with you as to how we landed here as a university. Before we had this requirement, we had students who had some coverage, but not comprehensive coverage here in New York. They would have to take a leave of absence late in the semester to travel home to access care that was covered by their insurance. And it was so late in the semester, their withdrawal resulted in nothing back, right? Full tuition, all of that was already paid, rendering the amount they paid way higher than the premium is of insurance, but also no option on that, right? Because the student was returning home to access care. We want to make sure students don't find themselves in that situation, that they can access care and stay in school, right? It's wonderful, as for me especially, to see those moments where students don't have to choose, do I stay at Columbia or do I go home for care? Right? We try to avoid that. But the cost of the plan is not a criteria for a waiver request or an appeal, I'm sorry to say. What we would instead do is say, how can we engage the financial aid team to figure out how to meet the needs for that student or that family? A person has been on our website. Thank you so much. Excited to hear you've been poking around, and noted the group on time management, study skills. So resources like groups that help people develop skills on time management study, those actually are interdisciplinary. So we have our health promotion team, our counseling center, our disability services team. They all work together to provide these resources to students. Right. Every one of the group pieces has a way to connect, either an email or a web form to fill out that gets folks connected. And then we bring an interdisciplinary perspective. And, I mentioned this is another bit of a humble brag here, but, we always focus on experts. There's a book chapter out there on time management for college students. It's in a series on well-being and wellness issues for higher education. I wrote that book chapter, right? I leveraged my expertise both as an administrator and as a faculty member to take one of my areas of study, which is time management, and turn that into a book chapter. And then we use those resources to help our students because we've got the expertise in-house. So each of the groups will have a connection point described on the website. Yes, it is from this year. There was a question, are these recent? We are constantly adding new ones based on the needs of our students. Right? We don't offer groups because we're interested in them. We offer these groups and opportunities because this is what our students are indicating they need. Time management is definitely one of those that is perpetually available, and students can do that in a group format, or they can do it one-on-one. Time management is actually a common topic in our wellness coaching program. Next question, a person indicated that their student has OCD and they're wondering if it's okay to connect with our team around coordinating the continuation of care. Absolutely. Note that on the health history form. Go ahead and what I would say is have the student reach out to us, right? Because we want to get to know them. If there is documentation from a previous provider, that's always very helpful, but not necessary in every situation. So the short answer to the question is yes, and please reach out at the earliest opportunity, but we can certainly work on a transition of care. For that and so many, many other things. Next question, if emergency surgery is needed, is that covered by the Columbia plan? Yes. Does the student need to pay and be reimbursed? No. Generally, the answer is no. If you're in the United States, it shouldn't be an issue. If you're outside the United States, in some cases, an individual pays for care and is reimbursed, but certainly we work with students, especially when our students are traveling, to make sure they understand what they need and how they can access the care. Our focus is always get the care you need. We'll figure out the payment later. right? We don't want, can I pay for this, to be a barrier to access, especially in the situation of emergency care. Clarification question, is the health fee included in the total cost of attendance? Yes, it should be specifically listed as part of the total cost of attendance. Next, is there a proactive consent form if the student can't make medical decisions due to a bad accident? And obviously hoping that that's never used. There isn't a proactive consent form in that particular type of scenario. But if a student were to be incapacitated and we have record of a family member on file, we're going to reach out, right? We understand there are situations that unfortunately occur in the world where an individual can't make their own health decisions regardless of their age. So we have a process in place that we would engage should it be necessary to reach out to others. So not to worry, people won't be in the dark, but it doesn't require completion of a particular form. Next question, a 30-day waiting period applied to dental and vision insurance. There's no 30-day waiting period on any insurance. Once a person has signed up for the plan and the beginning day occurs, the plan is active. So all of our plans begin on August 15th and they end at midnight on August 14th of the following year. So it's a mid-August to mid-August cycle. This is associated with think about students arriving early for orientation, the coverage is already in place, etc. So no waiting periods around using insurance. And again, if a person were to enroll, let's say mid-September, it's retroactive to August the 15th. So that period, if there were any out-of-pocket expenses, our team can help students submit those for reimbursement. And the insurance piece is not connected to the course registration process. So it's only the immunization compliance that would block a course registration. Another question, if a waiver is granted, how do you go about finding a doctor or hospital? So if we needed to refer somebody off campus, we're going to take their insurance into consideration, right? We're going to make that a part of our referral process so that a person who is not on our plan has the same benefits off campus as a person who is on our plan, right? What we really are trying to do here is minimize out-of-pocket expenses as a person goes off campus for care. And then the next question is is there a requirement for a healthcare proxy form? And if not, will we hold one on file if it needs to be accessed by hospitals in an emergency? So there isn't a particular form. It's sort of similar to the earlier question, but we can coordinate care with local hospitals because we have credentialed people at those people who are credentialed both with our team and with the hospitals. So Mount Sinai Morningside, which is the one directly across the street, or Columbia Presbyterian, right? We have folks who are credentialed at these hospitals, which allow us to help coordinate care and then in turn communicate with family as is necessary or as is requested by the student. The next one, actually not a question, just a note of appreciation. So no, and I thank you for the kind words. But I'm very grateful that you all chose to spend a little bit of your day with me, whether it's in the live session or by viewing the recording. It's always exciting to get to engage with family members and to sort of be part of the team welcoming everyone to the Columbia family. I'm coming up on September 6th, will mark 18 years I've been a part of the Columbia family. And it's just equally as exciting to welcome new students now as it was that very, very first year. Okay, there's two more questions before our time wraps up today, so let me get to those. The person is indicating that the health fee is not listed in the finalized offer from the financial aid office. So the financial aid offer is different from the total cost of attendance. It is part of the fees that is in the tuition and fees. So there are a number of mandatory, I know this gets very confusing because it gets aggregated in certain places and then it gets broken down in other places. Health and related services is mandatory, so it is a part of the cost of attendance. That amount may get added to the other mandatory fees and you just see a total amount in some documentation, whereas on a student's bill, it'll break out as a separate fee. So you know exactly how much each part is. So it is likely there. It's just not so transparent as it is on the student billing piece, right? This is where we would encourage the families to connect with the financial aid team. And we can see the breakdown of certain fees in our system. We have to have, if we're talking with a student, we would ask their permission to take a look at their account and see, but it's going to be there automatically. In some cases, it gets added right up front. In other cases, it gets added at the point of registration. But it is always part of the anticipated cost of attendance. That's a federally guided piece. And so we always provide the information to the central financial aid team so that they can incorporate that into the materials that are posted on the website and shared with others. So. And then that last question is a vaccine question. It's around the meningitis. There are two different, and I appreciate you asking the question because you're asking, is meningitis B vaccine recommended or just the ACWY? So we encourage both, right? We're big believers in vaccines helping prevent disease and illness. So the New York State law requires students to make an informed decision on the ACWY vaccine. The meningitis B vaccine is a completely different vaccine. We recommend students have both. They need to make the informed decision on the ACWY. And if they say I've had it and then upload proof of the Men B vaccine, we'll send that clarifying. Great that you had this vaccine. Unfortunately, it's not the right one. Do you have a documentation of this other one? So I appreciate you bringing up that there are those two meningitis vaccines. So thank you so much. All right, we have reached our time today. We're actually a couple minutes over, and I want to be respectful of the schedules of those that joined us live. So thank you so much for joining us today. We encourage you to visit our website, connect with our team. We do have a general email address, health@columbia.edu. If you're not quite sure which part of our team to connect with around a question, you can send it to that central address. It is reviewed by human eyes, and it is routed to the right part of our organization to provide an answer, or response, or support. So your answer may not come from health@columbia.edu, but you're welcome to send your questions there. And when you do, you will get a quick auto reply with some core information, common questions we receive. And then, like I said, those human eyes, I'm one of those people that reads those messages, will route those to the right members of our team. With that said, thank you again for those that were able to join live. A special appreciation to those that watched the whole recording in its entirety and got to this point. And let me end where I started in saying, welcome to the Columbia family.